Now we're going to discuss the first phase of rehabilitation following slap tear surgery. Now, slap tear refers to a specific type of injury to the labrum of the shoulder, which links to the superior labrum from the anterior to posterior, and that's where the acronym SLAP comes from. Now, the labrum is a ring of cartilage that surrounds the shoulder socket, helping to stabilize the joint and provide attachments for various tendons and ligaments. Now, in a slap tear, the top, so the superior part of the labrum is injured, where the bicep tendon attaches to the shoulder. Now, these tears typically occur due to trauma, repetitive overhead motions, such as in throwing athletes, or just the nature of aging. In the first phase of rehabilitation following slap tear surgery, the primary goal is to protect the repaired labrum and the bicep tendon, which is often involved in slap injuries. Now, this phase is really important because the surgical site is still healing, and any excessive movements or strains could disrupt the repair. Now, we're going to discuss certain things that should happen within the first phase of rehabilitation and why certain precautions are essential. Immediately after surgery, the body's natural response is to initiate healing, which involves the inflammatory process and tissue repair. However, protecting the labrum and the bicep tendon from unnecessary stress is really important to ensure the repair holds and the structures heal properly. Now, during the first stage or first phase of rehabilitation, immobilisation is important. The shoulder is typically immobilised in a sling for 4 to 6 weeks to prevent movement that could place tension on the healing labrum or pull on the bicep tendon attachment. Now, the labrum needs time to re-adhere to the bone, and the bicep tendon, which is often attached to the superior part of the labrum, is highly sensitive to movement. Now, managing pain and inflammation is really important in the early days post-surgery. Now, pain increases muscle tension, which can strain the repair site, especially around the labrum and the bicep tendon. Now, how to manage? You can use the prescribed pain medication from the medical doctor. You can use ice therapy and elevation to reduce swelling. Now, controlling pain allows for a smoother progression into rehabilitation exercises, as the patient is more comfortable and less likely to guard or overprotect the shoulder. Now, during this phase, active shoulder movements, where the patient uses their muscles to move the arm, should be strictly avoided. As we already said, the bicep tendon is especially vulnerable during this period because it attaches to the top of the labrum, where slap tears typically occur. Any active contraction of the bicep muscle, such as lifting or carrying objects, could place significant stress on the healing labrum and risk re-tearing the repair. Now, patients should avoid lifting, carrying, pushing, or pulling with the affected arm. Even small, seemingly harmless movements could activate the bicep or other shoulder muscles, which could disrupt the healing tissue. Now, passive range of motion exercises. Now, while the shoulder needs to be immobilized most of the time, gentle passive range of motion exercises are often introduced early to prevent stiffness and to maintain some mobility without stressing the repaired tissue. These exercises are passive because the muscles around the shoulder are not actively involved in moving the joint. Instead, the sports therapist or the patient's other arm assists in the movement. Now, you need to have considerations of the bicep tendon. As we know, the bicep tendon is attached to the labrum. It's important that passive movements do not engage the biceps. Movements like placing the shoulder in extreme ranges, like full overhead flexion or external rotation, could place stress on the bicep tendon. Now, the goal is to move within a controlled, pain-free range to maintain flexibility without straining the repair. Now, examples of safe movements include pendulum swings. So the patient leans forward and allows the arm to gently swing in small circles, using gravity to passively mobilize the shoulder. Gentle arm rotations, so assisted by a sports therapist or the patient's other hand, the shoulder is rotated gently within a pain-free range. What do you need to avoid? You need to avoid active flexion or rotation. These could involve the biceps and place tension on the healing labrum. Overhead or extreme external rotation. These movements place stress on the shoulder and could risk the repair site, especially where the bicep tendon attaches. Now, the bicep tendon plays a key role in shoulder stability, but it also places stress on the labrum when it contracts or is stretched. So after a slap tear repair, the bicep tendon is highly vulnerable because it attaches directly to the superior labrum, which is the area of repair in a slap tear. So contraction of the bicep muscle, such as during lifting or carrying, places direct tension on the repaired labrum and could lead to a re-tear or delayed healing. Because of this, certain movements that engage or stretch the bicep tendon must be strictly avoided in the early stages. Now, these include bicep curls or any motion that activates the bicep, reaching overhead or behind your back, which can stretch the shoulder joint and place stress on the labrum and bicep muscle. Now, the aim is to allow the labrum to reattach to the bone and the bicep tendon to heal without any additional forces pulling on these structures during the really important healing phase. So in summary, in the first 0 to 4 weeks after slap tear surgery, protecting the repair is really important for successful healing. Immobilizing the shoulder, managing pain, and avoiding any active movements, particularly those that stress the bicep tendon, are key priorities. Passive range of motion exercises may be introduced to maintain some mobility without placing stress on the labrum or biceps. Following these guidelines ensure the shoulder will heal properly and sets the stage for future rehabilitation phases.